are listening or watching Radio Afinju. The time is 5 p.m.
Ẹ bá mi pè o. Àfínjú. Kí lorúkọ rẹ̀? Àfínjú. Rédíò. Àfínjú. Gbogbo èèyàn ló ń gbọ́ àfínjú. Gbogbo èèyàn ló ń gbọ́ àfínjú. Lórí WhatsApp. Àfínjú. Instagram. Àfínjú. Facebook. Àfínjú. Lórí X. Àfínjú. Lórí YouTube. Àfínjú. Lórí TikTok. Àfínjú. Kí lorúkọ rẹ̀? Àfínjú. Ẹ bá mi pè o. Àfínjú. Rédíò. Àfínjú. Gbogbo èèyàn ló ń gbọ́ 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 àfínjú. Rédíò àfínjú. Rédíò àfínjú. Rédíò àfínjú.
Na my hustle be this. Na here I dey see my daily urgent 2k o. Ìhà yín ni mo ti ń rí ẹgbẹ̀rún méjì náírà pàjáwìrì tèmi lójoojúmọ́. On this program, we will bring people from different business backgrounds to come tell their stories and share insights with us. Gbogbo ẹ̀yin oníṣẹ́ ọwọ́, oníṣòwò, ẹ gbáradì. Ètò ti kàn yín ní rédíò Àfínjú. Bó o lẹ ti bẹ̀rẹ̀, kí ni àwọn tójú yín rí? Kí lẹ̀ ń tà gangan? Bó o lẹ sì ti ń tà á? My hustle will give you a direct insight into the business world. Join Aderonke Lawal, Ayoka Ọmọ Àkànmú on my hustle every Wednesday 4 p.m. to 5 p.m. on Radio Àfínjú to have your mind blown. Ẹ lè tẹ̀lé wa lórí gbogbo ìkànnì abánidọ́rẹ̀ẹ́ wa pátápátá ní Radio Àfínjú. My hustle, my urgent 2k.
Here on Doc on Radio, we are shining a light on why your well-being should always come first. From everyday health tips to deep medical insight, from nutrition to fitness, from top doctors to latest medical research, we've got it all. Bringing you expert advice, answering your burning questions, and helping you live a healthier and happier life. How cool is that? Join Pearl Durotoye every Monday, 5 p.m. to 6 p.m. only on Radio Àfínjú for Doc on Radio. Watch us live and follow Radio Àfínjú on Facebook and YouTube so you don't miss out. Because your health matters and great health is something you deserve.
Good evening. You're welcome once again to another episode of Doc on Radio here on Radio Àfínjú, the radio station with an impeccable dimension to broadcasting. My name is Pearl Durotoye, and here on Doc on Radio, we focus on your health. We focus on your well-being, how to live the best healthy life possible. We share wellness tips on the show, wellness tips to enable you live a healthy and longer life. And here on Doc on Radio, I won't be the only one talking. Subsequently, we're going to be having health and wellness experts, practitioners, people who are playing key roles in the health industry. And together, they are going to be sharing their insights based off of years of experience and practice, helping you, sharing tips with you, tips that you can do by yourself or things that you need to know about your health. You know, sometimes we just wake up and we start doing our daily activities. You don't even know what signs to look out for, but we're going to be having health practitioners here, doctors, pharmacists, anybody that is involved in the health industry. Occasionally, they are going to be joining me here on the show to share from their wealth of experiences. And also, I'm going to be giving my own personal take backed by our research, giving you wellness tips and how you can live a much more healthier life. So Doc on Radio is not just for you, it is for you and your family, it is for your friends, everybody, anyone that you love, anyone that you wish the best for. Tell them to join us here on Doc on Radio, because it is a show for everyone. And I don't know if you remember last week, I gave us a slogan. Yes, I gave us a slogan that when you hear Doc on radio, you say what? You say wellness made easy. Doc on radio, wellness made easy. And when I say wellness made easy, you say Doc on radio. It is very easy to remember. Don't worry, I know this is just the second episode. You get the hang of it. You get the hang of it. So if occasionally you want to call on the show, you want to ask questions, maybe you have questions for the guests on the show that day, or you want to just make health related inquiries, when you call us on the show, you're going to say Doc on radio, or you're going to say wellness made easy, and we're going to respond to you accordingly. So it is good to have you join me on the show once again. I'm very happy to have you here as someone passionate about health, physical health, mental health. It is my utmost pleasure to be here once again, telling you about ways in which you can improve your overall well-being for you to live the best possible life, for you to increase your lifespan. You know, this life is very, very sweet. Life is very, very sweet. But how sweet is life when you can't even enjoy it, when your body cannot enjoy it at its utmost capacity, when everybody is enjoying eating their favorite meals, going to their favorite places, and you're just down sulking in your bed because you are down with one illness or the other. So that's why I'm here, to help us live a healthier life. Last week on the show, I started with the very basic. I started with taking charge of your health. Taking charge of your health. I shared tips on how you as a person, you can take charge of your health. It starts with you. You see, healthcare is a journey. You can't just say, oh, I'm okay the way I am, I don't need anything, I don't need to see any doctor, I don't need to go to any hospital. But again, healthcare is a journey. You can never be too healthy. That's one thing I've come to realize. You can never be too healthy, because everywhere you turn, everywhere you go, there's one germ waiting for you. There's one bacteria waiting in every corner that you turn. You might think, okay, today I'm not going to do anything that will expose me. But if you don't do something that exposes you to disease and bacteria, someone around you might be doing it. Someone around you might be doing it. The person next to you might be carrying germs on their hand. The person next to you might have a cold flu, and you're just one sneeze away from contracting that germ that they have in their body. So you can never be too healthy. There is no such thing as, oh, I'm too healthy, I don't need to see a doctor, or I'm too healthy, I don't need to go to the hospital, I don't need to do this, I don't need to do that. There is never such thing. You have to always watch out for your health. And again, last week I talked about preventive health care. How can you prevent yourself? I mean, sometimes it's really not up to you, because you can do everything possible to ensure you don't fall sick, but one reason or the other, or due to some external factors, you find yourself down with one sickness or the other. But still, we can only try our best. You can only try your best. So I talked about preventive healthcare. Preventive healthcare are those proactive steps that you take to protect yourself, to prevent your body from against germs, against diseases, against infections. So those are those steps that you take. And I also mentioned that preventive healthcare is of three types. The first one being the primary health care. The primary preventive health care. This one prevents the occurrence of diseases. That is, before that disease comes, you have attacked it heads on. Before it comes. And this has to do with taking a regular screening, going to the hospital, getting vaccinated, eating healthy. Don't wait until you are down with one sickness or the other before you start eating healthy. Start now. So that's for the primary preventive health care. I also mentioned the secondary preventive health care, and this has to do with identifying diseases early, when they are still in their premature stage, when they are still budding, before it gets too intricate, before it gets too complicated. Controlling diseases, controlling the spread, the growth of diseases before they get too serious. So that's for secondary preventive healthcare. And then the last one was the tertiary preventive healthcare, which had to do with reducing the impact of already existing sicknesses and injuries. So maybe you're already down with a certain sickness or disease. So how do you ensure that it doesn't go out of hand? How do you manage it? How do you manage it? Maybe you have asthma, you have diabetes. How do you ensure that these conditions do not get complicated? You have been diagnosed with this condition, it has already gotten to this serious stage. How do you ensure that it doesn't get even worse than that? How do you ensure that it doesn't even get more life-threatening than that? That's for the tertiary preventive healthcare. And I also talked about why it matters. It saves cost, it reduces the pressure on our health care, and it also improves your quality of life. So these are a few of the points that I talked about last week. These are a few of the points I talked about last week. And this week, however, we are talking about something is still relating to preventive healthcare, by the way. But like I mentioned earlier, you can do everything you want to do. You can carry out all the preventive measures that and somehow you still find yourself down with one disease or the other. Let's take malaria for instance. Sometimes it's not of your own doing. There's mosquitoes everywhere, especially in a country like Nigeria. There's mosquitoes everywhere, in this region especially. So yes, you clean your house, you go to the hospital, you do this, you do that, but one female anopheles mosquito bites you and you're down with malaria. So and then you have to go to the hospital to see a doctor. So what do you do? We're going to talk about that once I come back from this break. Don't forget, it's still Doc on Radio, Wellness Made Easy on Radio Afinju. A very quick break and I will be right back. We're going to talk about what to do now that you've carried out all the preventive healthcare that but you're still sick. You've gone to the hospital, you have been diagnosed. Where do you go from there? It's one of the two major topics that I will be talking about today. So don't go anywhere.
lójú pópó ǹjẹ́ o mọ ẹ̀tọ́ rẹ lábẹ́ òfin lójú pópó bẹ́rù bá sọnù níbùdókọ̀ ǹjẹ́ o mẹ́ni tó pè òfin wo ló dẹni tó bá kọ̀ láti lo bẹ́líìtì ìdáàbòbò níbo ni súnkẹrẹ fàkẹrẹ dé dúró láàrin ìgboro ẹ má làágùn jìnnà. lójú pópó pẹ̀lú àyọ̀ká lẹ́tì máa gbọ́ ìdáhùn sí àwọn ìbéèrè wọ̀nyí lórí rédíò àfínjú ìkànnì ìlànà gbóhùnsáfẹ́fẹ́ àlárọ̀ọ̀tọ̀ ní gbogbo ọjọ́ ajé ọjọ́rú àti ọjọ́ ẹtì.
láago 9 sí aago 9 àbọ̀.
orí ètò ìbákan náà lẹ́tì máa láǹfààní láti mọ bí ṣe ń lọ ní ojú pópó àti àwọn ibùdókọ̀ káàkiri ìgboro.
ẹ pàdé èmi ọmọ yín ọ̀rẹ́ yín olólùfẹ́ yín Adérónkẹ́ Lawal Àyọ̀ká ọmọ Àkànmú ìrènìmọ̀gún ni mí ọmọ àyóyọ̀ Èjìwándé ará àlágbẹ̀dẹ ọmọ àwòrìn túnirọ̀.
lójú pópó pẹ̀lú àyọ̀ká ẹ máa gbọ́.
Okay, you're welcome back to the show. If you're just joining, it is Doc on Radio here on Radio Afinju, your wellness and health care radio show. Don't think it's only on TV that you can watch you can watch healthcare, or only when you go outside there and join seminars or all of that. No, you can learn more about your health here on Radio Afinju. So I said today we're talking about what to do after your preventive healthcare, what you do if you eventually do end up in the hospital and then you've been diagnosed with one or two things. What do you do? The first thing is, when you've gone to the hospital and the doctor has told you, okay, this is what is wrong with you, this is what is going on, they've given you, you've done your screening, you've done your test, and they've given you your results. The first thing you do is to ensure you understand the diagnosis. Ensure that you fully comprehend what they have said is wrong with you. Sometimes you go to the hospital and they use a lot of medical terms, medical jargon, and you're lost, you're confused. Don't stand there and be nodding like you understand. If you don't understand, please ensure that you ask questions. Let the doctor or the medical practitioner explain to you in layman's terms what the issue is. If they say, okay, oh, it is high cholesterol. Okay, doctor, what is high cholesterol? What does that mean? What is going on with me? What's happening to my body? They say, okay, high blood pressure. Okay, what is high blood pressure? What's happening? Blood sugar. Okay, what is that? What does that mean? What does that mean? Because it is in understanding what is going on with your body. That's when you can know or understand what it is you need to do to correct or to control whatever issue it is that is going on with your body. So please ensure that you understand what is going on with your body and also understand the level at which that thing is going on. I know sometimes in the hospitals they try their best to not escalate things. It's what they have been trained for. It's what they that's why they are professionals. They will not tell you, oh, you're going to die in the next 7 days. No, they're not going to say like that. Even if that's the case, they will not want to tell you because they understand what that can do to you. That can make you anxious, right? So they will try to they'll try to beat it, just tell you, don't worry, everything is in God's hands. I don't know, even when you watch it in movies, if doctors want to tell if they want to tell somebody that, oh, we lost this person or this person died, they will tell you, they will try to say it in a way that you will not feel too anxious about it. So that's what they try to do, but still ensure that you fully grasp the extent of which whatever is going on with you is going on with you. So yes, you've gone to the hospital, they've written a bunch of medications for you. Try to understand what you are aiming to achieve so that you can understand your body better. You can understand the things that you need to do. That's one. Another thing is that taking action. What are those lifestyle adjustments that you need to carry out? What are those lifestyle adjustments that you need to carry out? Okay, you have been diagnosed with, let's say you've been diagnosed with HIV now, for instance. What are those changes you need to make in your lifestyle to ensure that this HIV doesn't get out of hand, to ensure that this HIV doesn't graduate to AIDS? What are those things you need to do? Because you can't be living a certain life, or you can't be doing some things. Okay, let's say for instance now, maybe AIDS can be spread through sexual intercourse, through sharing of personal sharp items and all of that. So let's say you get HIV through sharing of personal items now, and now you have been diagnosed by a medical practitioner that, okay, you have so and so. Do you still, after that diagnosis, do you still go out there and keep sharing personal effects? No, you don't do that, because now you are fully aware of your condition, and now you have to make lifestyle adjustments. So if you're the type that goes to the barber, you go to the salon and they use their clips there, now that you have been diagnosed with a certain health condition, you know that, okay, you're not supposed to be sharing these things. I mean, normally you're not supposed to be sharing it, but unfortunately it has gotten to a stage where, due to that action that you carried out in the past, you've contracted 1 or 2 diseases. So what do you do now? You have to make lifestyle adjustments. Why do you have to make these lifestyle adjustments? Now, not only are you protecting yourself, you are also protecting those around you. You are also protecting those around you. Just like someone diagnosed with maybe tuberculosis, okay, you're not supposed to maybe share certain personal effects. There are some lifestyle changes you need to take. You have diabetes, okay, you have to reduce your sugar intake, all of that. So it doesn't just end at, okay, take your drugs, do this, do that. You also have to make personal conscious efforts to ensure that whatever it is, the infection, disease, whatever bacteria that you have inside of you, one, it does not get out of hand for you, and also it does not spread to your loved ones around you, right? So maybe it has to do with you improving your diet. That's also a lifestyle change. Maybe it has to do with you sleeping early. That's a lifestyle change. So you have to make conscious effort to improve your well-being. So why is it important? Maybe another thing is, okay, you have been diagnosed, doctor has written a bunch of medication for you, they've written drugs for you. A lot of people do not follow, I wouldn't say they don't follow doctor's prescription. They do, but they don't follow it to the letter. I've seen people where doctor will write a bunch of medications for them. They'll be like, this drug is too much. This tablet is I mean, sometimes I'm guilty of that, right? This tablet is too much. Doctor, I don't want to take all this place. It's too much. Can you reduce it to one? Meanwhile, this is a medical professional that has your health history. They know what is wrong with you and they know what you need. So if it is 5 tablets you need to take for you to feel better, they are going to prescribe it. They are not going to reduce it because you say you don't like it. No. I've been in a situation whereby the doctor prescribed 1 tablet. The tablet was like so big. It was so round. I felt it would not get through my throat based on how big. I was telling the doctor, please, can you recommend something smaller? But that was what I needed at that point in time. So the doctor just suggested that, okay, maybe you should break it into 2 if you want to take it, if that size is too big. So a lot of people, they feel when doctors are writing drugs or medications, they just want to sell their drugs, or they just want to sell. That's why they're always packing drugs to give you. But these people know what you need. Maybe maybe based on the symptoms that you have told them you are facing, or based on the result of the test that you have carried out. They've seen what is wrong with your body, and they know how to address that illness to make you feel better. So they are doing what they need to do for you to feel your maximum best. So when you're saying, oh doctor, I don't want to do this, I don't want to do that, you're not doing yourself any good. Because even if you don't take it, the doctor still remains the doctor, but your body never remains the same. So why is it important that we as a people, we adhere to medical personnel, we adhere to these instructions when we are given? I'm talking now about the right way. When they tell you, okay, take this drug so and so way, or take it so and so time, or take this at so amount, take it within a period of time. Why is it important that we pay attention or we listen to these instructions when we are given? Number one reason is that it ensures effectiveness of treatment. It ensures effectiveness of treatment. Sometimes when you're taking drugs, let's use the same malaria example that I used earlier. Maybe you've been given a malaria medication to take for a period of 1 week, and then you start taking it from the first day, second day, third day, you start to feel like you're feeling better, or you start to feel better, right? The third day you start to feel better, and like, I don't even need to complete this medication. I don't need to finish it. I'm already feeling okay. I'm already feeling, why do I need to take more? And then you just stop that medication abruptly, just like that. You think you're feeling okay. This can lead to other complications for you. It can lead to antibiotics resistance for you, because at some point your body will not even want to react to these drugs anymore, because that's also a form of drug abuse. If you don't know, it's not taking drugs the time or the quantity doctor tells you to do. It's a form of drug abuse. They've given you a duration. Okay, take it morning, afternoon, night, or take it morning and night, or take it once a day over a period of 7 days. But it's any time that you remember that you take it. It's a form of drug abuse, and your body can build a resistance to these things. And when your body builds resistance to drugs, it gets to a point that no matter what drug you take, maybe it will not work for that purpose, for that reason that you are taking it. So you have to adhere strictly to medical personnel's instructions. When they give you instructions that, okay, take this by 8 in the morning, ensure if you have to set an alarm, do it. Do it. Because this helps the effectiveness of that drug. Another reason why you should adhere is that it prevents complications. It prevents complication. It keeps symptoms in check. If you're feeling so and so symptoms and so drug is prescribed for you, it is to curtail those symptoms, to prevent long-term damage especially. So maybe you are having a certain medical issue, but it can be controlled by those drugs. So you need to take those drugs exactly when you need to take them to avoid long-term complications, or to avoid worsening the condition that you already have. So it is very, very important that we are there. Another thing is that it improves the health outcomes. It improves the health outcomes. Like if you're feeling, there is no, it's not rocket science, honestly. You know that when you take so and so, you know that when you take this drug, when you take this injection that you need, when you take the antibiotics, you're going to feel better. You're going to improve the quality of your life. You know it. But for some reason, because sometimes we like to feel that we know our body better, but you don't. Yes, you to some extent you might know your body, but you're not privy to those scientific nuances, because there are certain things that go on with your body that you may not feel it, but it's happening, right? But it is when you go to the hospital, maybe you do a urinalysis or you do a blood test, the doctor checks this thing, they check it against so many research, because they've had several patients with such symptoms, so they already know what to look out for. They know that, okay, when you have so and so symptoms, when you have this, when you have that, it all leads to this. Why? Because they've been practicing, they've learnt it, they've done the research, so they can tailor it to a particular ailment. So maybe while you are there thinking, oh, it's just headache, they already know that it is not normal headache. What you're feeling is headache, but by the time they do this test, do that test, do this test, they know that, okay, this thing is beyond headache. It is not just normal headache that you can just take a painkiller for. They know exactly what is wrong with you. But you think, oh, it's just headache, I'm feeling headache, I'm the one that knows what I'm feeling. But no. So it improves your overall health outcome. Another thing is it builds trust between you and your healthcare provider. It builds trust between you and your healthcare provider. See, it is one thing to, there are some patients that can be difficult. When you're sick now, you go to the hospital, the doctor tells you do this, do that, and you fail to do it. The next time again, you're back in the hospital, and then the doctor asks you, did you do this thing I told you to do? Did you take this? Did you take that? When you don't do these things they ask you to do, sometimes they fail to see reason why. Or how do I phrase this? Tomorrow when you come with a certain complaint, they don't know if you are being honest about it for some reason. But when you've built a certain level of trust with your healthcare provider, when you come tomorrow and say, doctor, my eye is paining me, they know that, oh, truly, your eye is paining you, and you are actually looking out for your own well-being. You want to be well. They won't take it as a false alarm. Why? Because they know that when they prescribe this for you, you're going to take it. When they tell you do this, you're going to do it as at when you're meant to do it. But when you begin to skip your medications, and next time you're going to the hospital, you tell them, oh, doctor, this happened to me, that happened to me, and they ask you, okay, did you take this drug when I told you to take it? And you say no. Tomorrow when you come again, they may not take you serious, because they will think you're not serious with your health care, or you're not serious with your well-being. Every time you're always complaining, but when they tell you to do something, you don't do it. So there is no trust between you and your healthcare provider. And it is very important for there to be trust. Because when there is trust, you can tell them exactly how you're feeling without feeling some sort of way. There is that confidence. They can trust in your own complaint because they believe that you already trust them with your life. You already trust them to make the best decision as far as your health is concerned, right? So it builds trust between you and your healthcare provider. And then lastly, it reduces the burden of healthcare. It reduces the burden of healthcare. When you take your drugs, when you're meant to, you go for your hospital appointment as at when due, not when they tell you come next week, you go 2 weeks later, because you're not allowing them to properly monitor how well you are improving. When they tell you come on so date and for no reason you skip it, you're not allowing them properly, because anything, remember I said it last week that as far as healthcare is concerned, every moment, every minute, every second counts. In fact, every millisecond counts, because health is so delicate that things can go from 1 to 100 in minutes, in seconds. So when you don't allow for that time for them to properly monitor as at when due, because maybe they've written a bunch of medications for you to take over a week, and then you come back and then they check, okay, what else have you noticed over this period that you've been away? And then you tell them, they can then prescribe another set of medications if needed. But when you don't go to the hospital, when you don't go for your appointment when you're meant to, how can they properly monitor your improvement? How can they know if you are improving or you are deteriorating? So you are reducing the burden of healthcare when you adhere to simple medical instructions. And I know I said lastly, but I just want to add this: it also improves your own emotional and mental well-being. Because trust me, it is I don't even need to say it, but you know that when you do things the way you're meant to do, you get well faster. You get well faster, and when you get well faster, you're able to do the things that you love, the things that improve your mood. You're able to eat properly. Your body is able to function at its utmost capacity. You can travel. You can literally just do the things you love. And when you do the things you love, your mental health is well improved. And it will even be evident not only on yourself, but on the people around you. So these are some of the few importance of medical adherence, why you should listen to your healthcare providers. All right. So I'll be going on a very short break now. When we come back, we're going to talk about when to seek medical help. When to seek medical help. You know, sometimes your body gives you signs. Some might be negligible, but not all are negligible. I know we love doing self-medication. Every small thing they'll tell you, even when you're home and you're having fever, oh, it's malaria. You know, people love to self-diagnose and self-medicate every little thing. Oh, I have this flagyl in my bag, go and take it with so and so amount of paracetamol, and just like that you go and take, without knowing what exactly is wrong with you. Because remember, some symptoms are alike. Yes, a lot of symptoms are alike. You might be having headache and you think, oh, it's just because I've been stressed. Meanwhile, you're having eye problems. You're having brain issues. So let's be very mindful of self-medication. Although that's a topic I'm going to treat on a different day. But when I come back from this break, I want to talk about when should you seek medical help. When should you reach out to a medical professional? When should you go to the hospital? When you're seeing these symptoms, what should you do? That's what we're going with. This is going to help us understand our body better, to know that, okay, some signs are not just ordinary signs. They are underlying symptoms of even more serious medical issues. So it's still Doc on Radio Afinju, and I will be right back.
For inspiring stories, real talk, from health and wellness to career and relationship, we explore it all. Meet your host, the Radiogem, and other women on Women Corner every Wednesday, 8 to 9 p.m., where sisterhood meets support. It promises to elevate your mind, and most importantly, it's gonna be fun. Follow us on our social media platforms: Facebook, YouTube, Instagram, TikTok, X, all at Radio Afinju. Keep a date with us on Women Corner every Wednesday, 8 to 9 p.m.
on Radio Afinju.
Maka akụkọ okwu gbasara ndọrọndọrọ ọchịchị, egwu ma ọ bụ ihe na-eme na Naịjirịa ma ọ bụ ihe na-eme na mba ofesi, omenani, mgbasa ozi, ihe ndị a niile dị na Radio Afinju. N'eziokwu, Radio Afinju bụ nke ezizi na radio stations na Osun State. Radio Afinju bụ amaala na ịgbasa ozi.
For an ultimate entertainment experience, an all-round gist with your spicy honey drops and Radio King Classic every Monday, Wednesday, and Friday, 2 to 3 p.m. for a thrilling ride. Don't miss the fun, excitement, and updates on Afinju Arena, only on Radio Afinju.
Apology for what you say, don't play. Are you in?
Wellness made easy, Doc on Radio. It is still Doc on Radio Afinji. If you're just joining us, this is your radio health and wellness show where we share practical tips about taking care of your health, taking care of your body, watching out for those signs, what to know, and when to reach out to medical professionals, and how you can also manage certain medical conditions. I also mentioned earlier that we're going to be having health experts, health practitioners, professionals in the health industry here on the show to share from their wealth of knowledge on better ways that we as a person or as a people can pay more better practical attention to our well-being. So now I want to talk about understanding your body, when to seek medical help. How do you know you need medical help? Remember, I mentioned that sometimes we have certain symptoms that we just dismiss. We think it's one of those things. It's just headache. It's because I've had a long day. Oh, it's just headache. And that's why sometimes you see people. Sometimes we've heard of news where people sleep and they don't wake up. It can be as a result. You say, oh, it's village people. He had a dream. They attacked him in a dream. But sometimes these things are as a result of underlying medical conditions that they have been neglecting. You see people, somebody that is just running, and before you know it, they just slump and died. It can be as a result of an underlying medical condition. So things don't just happen like that. Our body doesn't just suddenly fail. There will be signs. There will be signs. Your body doesn't just break down. I made an example sometime last week that even before your phone spoils, it has shown you signs that it wants to spoil. But because you're living in denial, you don't want to spend money. You ignore it. Your battery is already swelling up, but you're ignoring it because you don't have money to buy a new battery. There will be signs. There will be signs. So the signs is just like before it rains, it gets windy, the sky is already cloudy. Those are signs that it wants to rain. You get? So things don't just suddenly happen. Yes, sometimes they suddenly happen, but most of the time the signs are there. So what are those signs that you're going to see and you're going to know that, okay, this is beyond me? This time around I need medical help. I need to see a doctor. I need to see a nurse. I need to see a specialist in so and so area. What are those signs to watch out for? Because these things will help you to understand your body better. It will even help you to know what you're looking out for as far as your body is concerned. So one of those signs is unusual tiredness, fatigue. You're always tired. You don't know why. Whether you do anything, even if you've been sleeping all day, you're always tired. You sleep, you are tired. You don't sleep, you are tired. You stand up for 1 second, you are tired. Every time, anything you do, you are tired. It can be a sign of an underlying sickness. It can be a sleep disorder that is worrying you. But you wouldn't know unless you see a medical professional, unless you are properly diagnosed. So don't just say, I'm just tired, or I'm just overwhelmed. Every second of the day, every time you are tired, then there is a problem. There is something. You may not be in pain at that moment, but it is a problem. So you need to seek a professional. Let them check you. Let them do a body screening. Let them know what exactly is wrong with you so that you can know what really, because there is a wide range of health challenges in this world. There are a lot of health issues that you've never even heard about. In fact, I've heard of the most, I won't even call them ridiculous. They're just unimaginable. You will not know that. So there is such a sickness like this. And some of them are so scarce that sometimes it is 1 in a million. Do you know how scarce 1 in a million is? Right? But there's somebody in this world going through that. And you don't expect that. In fact, even in the world of science, before the research, because research takes money, it takes time, you need funding. So 1 in a million is not that much of an occurrence for one medical company to say, okay, we want to pump money into the research of what is causing this disease. Why? Because it is not yet a global pandemic. It is not something that is causing tens and thousands of people to die. It is just 1 person in a million. So it is very important that we pay attention. It is very, very important, because the earlier the better. Don't wait until it gets to that very, very critical level, because at that time they can't even manage it anymore. So pay attention to your body. If you're always tired for no reason, whether you sleep or you are awake or you eat or anything you do, you're always tired, pay attention. Second thing you should pay attention to is persistent pain. You're always in pain. You're always having pain, or pain in your head, pain in your back, your waist, anywhere. You're always having pain. Every small thing, my waist, every small thing, my leg. Oh, I'm feeling pain in my butt, in my neck. Pay attention. pay attention. Don't say it's just maybe because I hit my head when I was small, that's why I'm having headache. Or when I was secondary school, somebody used wood to hit my wrist, that's why I'm always having pain there. Go to a doctor, see a medical professional. Let them be sure that nothing is wrong with you before you can conclude, because pains can also be as a result of inflammation. It can be as a result of injuries. Some injuries might be internal. Maybe you were playing football and somebody hit you, you know. Of course, you may not know, maybe because there's no injury that you can see, but inside, some nerves, some tissues may have been damaged. But because you can't see them, you wouldn't know. But when you go to the hospital, they are going to check all these things and they can be sure of what is going on and they can treat it before it gets complicated. Another thing to watch out for is sudden changes in your body. Are you noticing your skin color? You're suddenly getting pale. Your skin is getting pale. Your eyes are getting very white. Or you're feeling a lump or a mole in your neck, in your breast, in different parts of your body. You can just feel an abnormal growth, something that was never there before. You start to feel it, but for some reason you think maybe it's the ant that beat me when I was sleeping. Pay attention. Pay attention, especially when it comes to skin conditions. It can be an underlying symptom. It can be cancer. It can be anything. It can be any other skin condition. But if you're not paying attention, how would you know? Let's not be quick to dismiss a lot of these health issues. You might think, oh, it's very small, but most of these things, they start very small. You think it's just small kenken that beats me, Jerry. That's why and it has been growing for days, for weeks. You're not paying attention. Please pay attention. Another thing we should pay attention to is sudden weight loss and gain. If suddenly you're not eating too much, you're eating the normal quantity of food you are eating, but you just see yourself, you're just gaining weight for no reason. Pay attention. Or you're losing weight drastically. You're not on any diet, you're not fasting, you're not doing exercises, and you're just seeing yourself, you're losing weight drastically. Pay attention. It can be as a result of hormonal imbalances or other serious issues. It can be anything. Pay attention. Because everything is a gradual process. Even when you want to lose weight the proper way, you don't just go from today you're weighing 80 kg, the next day you're weighing 70 kg. No, that's not healthy. Even if you're working out, if you're doing exercise, there should be it is usually a process. It is not all that. It's not usually drastic like that. You can't go from 10 kg to 1 kg the next day. No, there is a problem. It is not that exercise. Yes, I know sometimes when we're working out, you're looking for quick results. You want to see results immediately. But there's a time it will get concerning. There's a time you should know that, okay, this is not normal. But how would you know that when you don't pay attention? Another health issue to watch out for is breathing issues. You're feeling tightness in your chest or shortness of breath. Pay attention. I used to have sometimes when I used to have would I call it chest pain? Sometimes I would just feel this. It's not a chest pain. It's more like I don't know if it's bone. It's more like the ribs interlocking together. I used to feel it at some point, and then I had to go to a hospital. They said, okay, you need to do an X-ray, and then they did an X-ray, and then the doctor was able to say, okay, this is what is going on. But if I dismiss it, I said maybe it's the cold weather. Maybe it's pneumonia, Jerry. That's how pneumonia does. How would you know? Can you see the inside of your body? Do you know what's going on inside? No, you don't. But when you go to the hospital, when they listen to your complaints, they listen to the symptoms you have mentioned, they know what to do. So pay attention. Don't easily dismiss. I know sometimes people around you might say, otiman keraju, otiman jeki serious, but that little thing can save your life. That little action can save your life. Are you throwing up too much? Pay attention. Another thing to look out for is abnormal bleeding. You are bleeding from your nose. You didn't do anything. You're just walking around and you start bleeding from your nose. Some people from their eyes, from their ear. It can be anything. It can be an infection. It can be a brain issue. Can be a bleeding disorder, and it can even be more serious conditions like cancer and the like. But how would you know? How would you know? Maybe you bleed once and you just clean it. Maybe when this boy pushed me, that's why. Pay attention. Also for women, if you're seeing your period and you're bleeding too much, pay attention. There's a line between, okay, it's just normal menstrual bleeding, and this is too much. I mean, you should know when, okay, this is too much. If you're soaking more than 4 pads in an hour, that is a lot. That is too much. Pay attention to your body. Don't say, it's normal, that's that period. No, there's nothing normal about that. Pay attention. See a doctor. Let them diagnose you. Let them check. They have the experience. Pay attention. Another thing to look out for is digestive issues. Digestive issues. Are you throwing up? Are you vomiting? If you eat, you can't keep food down. You are purging. Whether you eat or you don't eat, you are sure going to the toilet 10 times a day. You are purging. You are throwing up. You are having constipation. You are having abdominal pain. Or you go to the toilet, you notice your feces has a certain color, strange color. Your feces is dark red. Oh, there's blood in your stool. There's this, there's that. Pay attention. Some of you go to the toilet and you just flush and you leave. You don't even know what color your poo is. You might think it is ridiculous, but it is not. Because little things like this, they are underlying symptoms of even more serious conditions. And that's why sometimes when you go to the hospital and they ask you, okay, when last did you do this? When last did you do that? When you can't tell, they don't know where to start tracing that issue from. But when they ask you, okay, when you vomit, what does it look like? When you go to the toilet, what does it look like? What's the consistency of your poo? When you can tell them, they can relate it to certain medical conditions and know what to prescribe or to know what test you can carry out. Pay attention. Urinary problems, pay attention. If you go to the toilet, you're having pain in your pelvic region. When you go to the toilet, your pee, it's always painful anytime you go to pee. Or maybe your urine, there's a change in your urine. Your urine is looking brown, it's looking green, it's having very funny colors. And you are thinking, oh, maybe it's that vegetable I ate. No. Your urine should either be very clear or a slight yellow color. Anything other than that is an issue. It can be kidney problem. It can be dehydration. Even dehydration, as little as you think it is, it can also lead to other severe complications. Dehydration, when you don't drink water, it can have an effect in your urine. When you don't drink water, it can have an effect. It can even lead to other more serious issues in your body. So, but pay attention. Sometimes when I use the toilet and I see that, okay, my urine is a little too yellow, I know I need to drink a lot of water. I know I need to drink more water. I need to incorporate more water in my diet. And that's why recently you see, I'm always carrying the bottle around, because being dehydrated is not good for you. So if you need to buy a bottle to take around anywhere you go, just so you have water readily available, please do that. You're paying attention to your health, because in the long run, it's going to benefit you. Another thing to pay attention to, quickly, because we're running out of time, is headaches. Are you always having headaches? Are you always having headache? Migraines. One corner of your head, of your temple, is always throbbing. And you think, oh, because I've spent so much time at work, or it's because I've done this too much. No, pay attention. See a doctor. How often does it occur? How often does this migraine occur? Okay, what have you taken about it? Have you taken this? If you took it, did it work? How many did you take? Pay attention. Let them know. Be honest about your symptoms. Be honest about what you feel when you are talking to your health practitioners. So if you're having constant headache, constant migraine, it can be a symptom of underlying eye issues. You might be going blind and you don't know it. Maybe you are seeing double. You just wake up from your bed and it happens a lot of times. Sometimes when you get up from your bed and your head just goes, you just suddenly feel dizzy. It can be a symptom of an underlying health condition. It happens a lot. A lot of these things, they happen a lot. Or sometimes you just be seeing double. You think, too much gari. You just make light of it. Oh, your gari too much. But you are going blind. You are going blind, but you don't know it. But how would you know? But when you go to the hospital, they can prescribe, okay, you need this, you need so and so this, you need drug, you need glasses, you need this and that. They can know how to quickly clip whatever it is wants to happen in the body before it goes extreme. And then next is fever. When you're having your running fever, your temperature is always hot, your fever is lasting several hours, it's lasting several days, even after you've you've gone to the pharmacist and they've given you medication, the fever doesn't want to go, you're always feeling hot, then you need to see a doctor. Don't let it end there. You need to see a medical practitioner immediately, because all of these can be symptoms of underlying health condition. Or maybe you have an injury that is not healing. You have an injury that has been there for several, it's just not healing no matter what you do. Or the blood, you are bleeding, you had a little cut and it's not healing, the blood is not stopping, then seek medical help. Seek medical help. And then lastly, or should I say second to the last, if you have a family history of certain medical conditions, you have a family history of certain medical conditions, you know that, okay, your grandmother had it, your grandfather had it, your mom had it, or your dad had it, someone in your family or two people in your family have this certain medical condition, then it's all the more reason for you to pay attention, because the chances that you're going to have the exact complication is there. It is very high. If in your family somebody had mental health issues, there is a chance that you're also going to have it. There is a chance, I'm not saying you will, but there is a chance. So you have to pay attention. If you have diabetes in your family, then you should know that, okay, you should not, there are certain things you should not do as somebody that is prone to it, because genetics is very funny. The family tree is very strong. That's why they say blood is thicker than water. There is a high chance that you're also going to suffer from the same condition. It can be anything. It can be cancer. If in your family somebody has issue of cancer, please pay attention to your health. Don't say, jump and pass, this one no go reach me, because sometimes these things don't start when it can start when you are young, it can start when you are in your middle ages, it can start when you are old, it can start at any age. So it is only when you pay attention to these symptoms that is when you can really know. And then I know I've mentioned this lightly, but mental health is also very important. If you have anybody still under this family history, anybody in your family that had mental health issues due to one or two, sometimes these things are very they are hereditary, they are passed on from generation to generation. So it might not be dominant, yeah, but it is present. And if it is present, it can be triggered by almost anything. So there are certain lifestyles, certain things you should not do to ensure that you are not made susceptible to these things. So pay attention. And also, lastly and finally, if you are unsure about any symptom that you are feeling, it is all the more reason why you should even see a medical practitioner. If you're feeling somehow, you don't know how to express it, just see somebody, see them, let them know. They know what. Don't worry. No matter how you explain it, they already know it. Why? Because they have witnessed it with several patients before. They already know what you are talking about. So don't say, I don't really even know what is wrong with me, but I'm feeling one kind, I'm feeling somehow. See a doctor, let them properly diagnose you and tell you what is going on with you. And that's where I will be drawing the curtain on today's Doc on Radio. I hope you have learned something. I hope we have learned to pay more attention, especially to your health. Health is wealth. It's not just a saying. Health is wealth. When you are healthy, you can do almost anything. That's when you can achieve your goals, those body goals, those health goals, life goals, dreams and aspirations. It is when you are alive in good health that you can achieve any of those things. So let's learn to pay more attention to our health. I'll be back again same time next week Monday, 5:00 p.m. Hopefully I'm going to have a medical practitioner here with me on the studio so that you can ask those pressing questions that you want to ask, so that you can ask and get answers from a real doctor here on Doc on Radio. Okay, and always remember that health is a journey, not a destination.